They handed her the worst patient on the ward, because they wanted to watch her fail. Welcome to Steady Badge's Stories. I'm glad you found your way here today. If this is your first time, these are the stories nobody tells at awards banquets. The quiet ones, the ones that happened in hallways and supply rooms and hospital beds, the ones that only matter if you were there. Hit the like button if any of this sounds familiar. Subscribe so you don't miss what's coming next. And leave a comment. Tell me where in Canada you're listening from. I'd love to know how far this story travels. Now let me tell you about Cora Finley. Cora Finley had been at Macdonald Veterans Medical Centre for 12 days when Charlene Dowd decided to make her an example. Charlene was the charge nurse on Unit 7, orthopedics and respiratory, shared ward, old building, the kind that still had radiators that knocked in February and a staff lounge that smelled permanently of burnt coffee and resentment. She had worked there for 16 years. She knew which doctors to flatter and which residents to ignore. And she had a particular gift for spotting the people she'd decided weren't going to last. She had spotted Cora on day 1. Cora was 34. She wore teal scrubs half a size too large. Her dark hair was pulled back in a low knot that kept sliding sideways, and she never fixed it. She spoke when spoken to. She did not laugh at the jokes at the nursing station. She did not complain about the supply shortages or the broken IV pump on the west side of the hall. She simply moved through her shift like someone accustomed to environments that were inconvenient. And that alone made Charlene distrust her. Too quiet, Charlene had said to Dr. Paxton on the second day. Dr. Victor Paxton was the attending on Unit 7. Internal medicine, 10 years at Macdonald, 3 complaints filed and 0 sustained. He was the kind of physician whose confidence expanded to fill whatever room he entered. He had looked at Cora once, decided she was unserious, and moved on. On the 12th day, a patient arrived who changed everything. Grant Aldrich was 41 years old. Retired Master Corporal, 3 Canadian Special Operations Regiment. He had been profoundly deaf in both ears for 3 years, a blast injury, a narrow road in a country he was no longer permitted to name in official paperwork. He had a below-knee prosthetic on the right side, and a history that stretched 14 pages in his medical chart, most of it redacted. He had been admitted that morning after collapsing at a prosthetics fitting clinic. Fever of 39.4, tachycardia at 118, right-sided chest pain, oxygen saturation at 92 and dropping. He had already broken a tablet. He had already refused to let anyone touch him. He had already signed something at the orderlies that the orderlies did not understand and did not try to. The nursing station note read, combative, non-cooperative, high-risk transfer. Charlene read the note aloud at the desk, then she smiled. She looked down the hall at Cora, who was updating a medication chart with her back turned. Room 9, she called out, Grant Aldrich, he's all yours. Dr. Paxton glanced up from his tablet. Should someone? She'll be fine, Charlene said. Good experience for her. 2 nurses near the printer looked at each other. One of them reached for her phone. Cora set down her pen. She did not ask for context. She did not protest. She walked to the nursing station, picked up the chart, and read it the way she read everything. Quietly, completely, without rushing. Grant Aldrich, 41, 3-so retired, bilateral profound hearing loss, right lower lobe infiltrate, query pleural effusion, CT pending, fever, tachycardia, right rib pain worsening over 4 hours, oxygen declining, 3 red flags stamped on the cover. She noticed something else. In the margin, in small handwriting from the paramedic who had brought him in, patient signing extensively on transport, staff unable to communicate. Nobody had tried. Cora picked up the chart. She walked to room 9. She knocked twice on the door frame before entering. Not on the door, on the frame, where vibration would carry through the wall. Grant Aldrich was sitting up against the headboard with his knees drawn in and his shoulders squared to the door. Not the pillow, not the mattress, the wall. Tactical habit. Never expose your back, never let the entrance come at you sideways. His eyes went to her hands the moment she stepped inside. Good. He was watching what mattered. She moved slowly, palms open, body angled so she was not blocking the exit. The 2 orderlies in the corner looked relieved in the way people look when they're about to transfer their discomfort onto someone else. You can go, Cora said. One of them started to protest. She looked at him once. He stopped. When they were gone, she raised her hands. My name is Cora. I'm your nurse. I won't touch you without asking first. Grant Aldrich went still. Not because she signed well, fluent, clean, no hesitation on the handshapes, no overmouthing the words the way people did when they'd learned ASL from a video the night before. Real fluency, the kind that lived in the body. His hands came up slowly. You sign. Yes. Who taught you? A friend to start, then I needed it for work. A beat, his eyes narrowed. What kind of work? Cora tilted her head. The kind I'm not doing right now. Can I look at your chart? The corner of his mouth shifted, not a smile but the edge of one, permission given. She reviewed his vitals at bedside. Oxygen 91, temperature 39.6, respiratory rate 26, too fast, and he was working for it. His right hand kept drifting toward his lower ribs. She noticed. She said nothing yet. She placed the blood pressure cuff and asked before she tightened it. He let her. That alone would have stunned the nursing station. Pain in your ribs, she signed when the cuff released. Yes, since this morning. Worse after the fitting clinic. Sharp or pressure? Sharp, right side, gets worse when I breathe deep. She listened to his lungs after asking permission, after he nodded once, left side clear. Right lower field diminished, not absent but wrong. Breath sounds that should have been there weren't. She stepped back. I need to flag this for the doctor. Grant's expression changed, his jaw set. The last doctor said anxiety. Cora held his gaze, the last doctor was wrong. He studied her for a long moment, then he signed something that was not ASL. It was short, 4 gestures, index finger position, wrist rotation, fist, open hand. Her blood went cold. She knew that sequence. It was not a public language. It was a field language, built for environments where radios were a liability, and silence was survival. She had learned it in a room with no windows and a whiteboard covered in mnemonics. She had used it in places she was not going to think about in a hospital hallway. He watched her face, saw the recognition she almost managed to hide. He signed the sequence again, then one word in identify. She should have looked confused. That would have been the safe choice. His oxygen dipped to 89. She answered with one sign from the field language, hold. I see you. Grant Aldrich stopped breathing for a full second. His eyes dropped to her left forearm, below the watch where an old rope scar crossed the inside of her wrist, pale and clean, the kind that came from a harness under load in very cold water. His hands moved slower. Rook? Cora felt the name land in her chest like something she hadn't known she was still carrying. That name is retired, she signed. Names don't retire, people do. I did. He shook his head slowly. You're here. The door opened. Charlene stood in the hallway. Dr. Paxton was 2 steps behind her. A junior nurse named Tyler hung at the edge of the frame with his phone not quite hidden. Charlene looked at the closed blinds, at Cora standing close to the bed, at Grant not restrained, not sedated, sitting upright and calm. Something moved across her face that was not pleasure. What are you doing? She said. Assessing my patient, Cora said. Dr. Paxton stepped in and read the monitor over her shoulder. His sats dropped. Yes, I need imaging reviewed. He has diminished breath sounds on the right, worsening pleuritic pain, fever, tachycardia. This isn't anxiety. Paxton's expression settled into the kind of patience that wasn't patience at all. He has a complicated history, blast exposure, PTSD, chronic pain. Somatic presentations are common in this population. Absent breath sounds aren't somatic. Diminished. You said diminished. I said diminished. I mean it's getting worse. Charlene's voice went flat. Nurse Finley, Dr. Paxton has reviewed the chart. The chart doesn't have a chest auscultation from the last 4 hours. Paxton looked at Grant, not at him, past him. The way people looked at things they'd already decided weren't worth looking at closely. Document the vitals, he said. I'll reassess in the morning if he's still symptomatic. His oxygen is 89. Supplement him. He needs imaging. Paxton turned toward the door. You are 12 days into this position, Nurse Finley. I'd encourage some humility. Cora looked at the monitor, 88. I'd encourage you to look at your patient, she said. Charlene inhaled sharply. Tyler's thumb moved on his phone screen. Paxton's face went rigid. You will document the vitals, administer supplemental oxygen, and you will not escalate without my order. That is not a suggestion. He left. Charlene followed. Tyler hesitated long enough in the doorway for Cora to meet his eyes, long enough for him to understand she had seen the phone. Then he left too. Cora closed the door. Grant had watched all of it. He signed, Dr. Stupid. Not the word I'd use in a chart. What word would you use? She considered it, delayed. He almost smiled, then his hand pressed harder against his ribs and the monitor climbed to 128. Oxygen held at 88, barely. She went for the rapid response button. The announcement hit the unit at 14:43. Rapid response, room 9, rapid response, room 9. Charlene's head came up from the nursing station. Dr. Paxton froze halfway to the elevator. The rapid response team was in the room in under 3 minutes. Respiratory therapist Danny Ochi came first, small and fast, already pulling her stethoscope loose. Behind her, a second-year resident named Priya came through the door reading the monitor. Cora spoke before anyone else could. 41-year-old male, AL primary, bilateral hearing loss. Right-sided pleuritic chest pain worsening over 6 hours. Fever 39.6, pulse 128, respirations 28, oxygen 88 and dropping. Right lower lobe breath sounds absent on auscultation. Danny placed her stethoscope, listened, moved to the right side, listened again. Her face changed. Dr. Paxton had followed the team in. I've already assessed this patient. This is consistent with his. There are no breath sounds on the right, Danny said. She was not talking to Paxton, she was talking to the room. Resident, I need a portable x-ray now, and someone get me a thoracics consult. Paxton's voice hardened. I am the attending on this unit. And I'm respiratory. Danny did not look at him. Can someone call thoracics? Grant's oxygen hit 84. He looked at Cora, his hands moved, Rook. She signed back without breaking his eye contact. Slow breath, eyes on me. Don't look at the numbers. He signed, voice dry as old paper, been worse. I know, stay with me anyway. The portable x-ray came back in 11 minutes, the film loaded on the reader. Danny leaned in, straightened. Right-sided pneumothorax, significant, possible early tension. Paxton stared at the screen, his mouth opened then closed. Grant's blood pressure began to fall, oxygen 80, pulse 148, his lips were going gray at the edges. Cora opened the decompression kit. Stop, Paxton said. You are not credentialed to perform that independently. You wait for my order. Grant caught her sleeve. He signed against her palm, one-handed, barely moving. You do it. He's consenting, Cora said. He is a patient with significant psychiatric history, and I am telling you to stand down. Cora looked at the monitor, 78. She looked at Danny. Danny stepped to the other side of the bed. Patient consent documented. I'll witness. Paxton shouted something. Cora had already cleaned the site, second intercostal space, midclavicular line, the landmark she had found by touch in darkness and dust in a country she was not going to name. Controlled force. Catheter seated. 1 second of nothing. Then the hiss. Air escaped under pressure. The sound was unmistakable, compressed, released, like a held breath finally let go. Grant's chest rose. 78 became 82, 86, 94. The room went quiet in the particular way. Rooms go quiet when something almost happened and didn't. Danny looked at Cora's hands. They were steady. Charlene stood in the doorway. She was not smiling. Tyler's phone was in his pocket. It had been there since the rapid response alarm. Dr. Paxton recovered the way arrogant people recover, faster than wisdom suggested, slower than dignity required. This nurse performed an invasive procedure without authorization, he said to the room. A thoracic surgeon named Dr. Andrea Ewan stepped around him in the doorway. She had been paged from the floor above. She took in the monitor, the catheter, the x-ray on the screen, and Paxton's face in that order. Who decompressed him? She asked. I did, Cora said. Dr. Yoon looked at Paxton. Why didn't you? No one answered that. Good save, Dr. Yoon said to Cora. Chest tube now, let's prep. Grant signed from behind the oxygen mask. She stays. Cora translated. Dr. Yoon nodded once, obviously. The administrative review was scheduled for 4 o'clock in the conference room on the 2nd floor, the one with the framed mission statement on the wall, and a potted plant in the corner that had been dead since August, but nobody had removed. Dennis Fournier, the hospital administrator, sat at the head of the table. Dr. Paxton sat to his right. Charlene sat beside him. Tyler sat at the far end with his arms crossed and his eyes on the table. Cora stood. She had been offered a chair. She did not sit. Nurse Finley, Fournier began. You performed a needle decompression without physician authorization. I performed a decompression with patient consent during active decompensation, while the attending physician did not act. You were instructed not to proceed. I was instructed to let a man die more slowly. That's not an instruction I'm able to follow. Charlene's breath caught. Paxton leaned forward. You are 12 days into a probationary contract. You have no standing here to. His oxygen was at 78%, Cora said. Standing doesn't oxygenate a patient. Fournier wrote something down. The concern about scope of practice is legitimate. The clinical concern was breathing. I prioritized correctly. There's also, Paxton said, opening a folder, the matter of how you communicated with him. He called you something. A name, Rook. The room shifted slightly, small, enough for Charlene to sit straighter. What does that mean? Fournier asked. Ask him, Cora said. We're asking you. And I'm telling you to ask the patient. Paxton's mouth thinned. We've pulled your employment history, Nurse Finley. There are 2 years with no record. Those years belong to me. Not if they're relevant to patient safety. Cora looked at him evenly. You ignored diminished breath sounds on a veteran with chest trauma, and a fever of 39.6 because you'd already decided he was a psychiatric presentation. That's what's relevant to patient safety. I'd start there before you come for my references. Fournier's palm went flat on the table. This is not a forum to. The door opened. Dr. Yoon walked in without knocking. She had the updated chart under her arm. I heard there was a review. Dr. Yoon, Fournier said, this is an internal matter. Patient safety is not internal. She set the chart on the table. Master Corporal Aldrich had a clinically significant right-sided pneumothorax with early tension physiology. Any further delay would have resulted in cardiac arrest. Nurse Finley identified the presentation correctly, decompressed with patient consent during active deterioration, and I will defend that intervention. Paxton stared at the wall. Patient consented in his primary language, Dr. Yoon asked Cora. Yes. Then we have nothing further to review. Fournier cleared his throat. Scope of practice is still. So is survival, Dr. Yoon said. Schedule them both. The door opened again. The room stopped. Grant Aldrich stood in the doorway in a hospital gown, chest tube drainage system hanging from one hand, IV pole gripped in the other. A step-down nurse hovered behind him, stricken. He had pulled his own leads to get there. His color was better, his expression was not. He looked at the table, at Paxton, at Fournier, at Charlene. Then at Cora. Translate, he signed. She hesitated half a second. Then he says translate exactly. His hands moved, she spoke. You assigned her to me as a joke. You recorded it. You called me difficult because understanding me was inconvenient. You assumed I was less because I was quieter. A pause. She answered me in my language before you answered me at all. She listened before she touched me. She saved my life while you discussed liability. Charlene closed her eyes. Tyler stared at the table. Grant's hands moved again. Cora's voice was flat. Her name is Rook. I know that name because she went back into a burning levee on a road outside Kandahar to pull 2 men out while comms were dead, and her unit had already called abort. She was attached to our element as a combat medic. She is the reason 2 men who should have died didn't. The conference room went the kind of silent that has weight to it. Fournier whispered, "Where?" Grant looked at Paxton. Cora translated the final line without being asked. Somewhere men like him would not have survived 20 minutes. Then Grant's knees buckled. Cora caught him before anyone else moved. They got him back to step down. Dr. Yoon adjusted orders. The chest tube was secured. By the time Grant's color returned, the unit looked the same from the outside. Same nurses at the station, same IV poles in the hall, same monitors chirping behind closed doors. But the rooms knew. An old infantryman in room 12 had heard the rapid response call. He didn't know the details. He raised 2 fingers when Cora walked past. Not a salute. Recognition. The kind that passed between people who understood that certain rooms were survivable only because someone had refused to leave. A veteran near the windows caught her eye and nodded once, slowly. A younger amputee stopped her near the elevator. That guy in 9, he doing okay? He's stable, Cora said. Good, a pause. Somebody finally understood what he was saying. Those words followed her down the hall. Because that was the real wound running through the building. Not deafness. Not blast injury or missing limbs or nightmares that made sleep feel like a second deployment. The wound was the accumulated weight of being handed a tablet instead of a person, of being called combative when the real problem was that nobody had learned the language, of being treated like a burden instead of a patient. Cora had come to Macdonald to disappear among people who understood what it cost to be quietly competent in a loud world. She had not expected to find so many of them still waiting to be heard. That evening, a military officer arrived on the unit. Captain Reese Brandt. He had driven from CFB Trenton and he looked like it. 4 hours of highway, and something urgent held carefully behind professional calm. He walked past the nursing station without stopping, and stood in the doorway of Grant's room for a long moment before he turned and found Cora in the hallway. He did not say the call sign aloud, he didn't need to. Petty Officer First Class Cora Ann Finley, he said quietly. JTF-2 Medical Assault Element, medically released under a sealed protection order following an incident in theater. Charlene had followed him from the station. She stood 6 feet away and did not pretend she wasn't listening. Brandt continued. Silver Star recommendation forwarded through American Liaison. 2 commendations still classified. She was listed as medically unavailable for operational service. A pause. She became a nurse. A long silence. She's been doing this since she was 26. Charlene made a sound, small, not a word. Charlene found Cora in the supply room that night. She stood in the doorway for a moment before she spoke. I set you up to fail, she said. Yes. I didn't know I didn't know any of. It wouldn't have changed it, Cora said. You did it because you thought I was safe to use. That part doesn't get smaller because the outcome surprised you. Charlene's jaw worked. I'm sorry. Cora looked at her carefully. Are you sorry because you were cruel or because you were wrong about what I could do? Charlene flinched. She didn't answer right away. I don't know yet, she said finally. It was the most honest thing she had said all day. Figure it out, Cora said, then come back. The formal review concluded 3 days later. Fournier sat across from Cora in the same conference room. Paxton was not there. He had been placed on administrative review. 4 complaints filed over 8 months by nursing staff had been located and, apparently, reconsidered. The 5th, filed by Dr. Yoon, had not required any reconsideration at all. Charlene was present. Tyler was there, red-eyed, seated at the far end of the table. Captain Brandt attended as a courtesy. Nurse Finley, Fournier began, on behalf of Macdonald Veterans Medical Centre, I don't want an apology, Cora said. Fournier set down his pen. I want policy. He looked at her. What kind of policy? Cora had written it out the night before in the break room, while Grant slept 2 floors up and the hospital settled around her into its nighttime sounds. Every deaf and hard-of-hearing veteran admitted to this unit receives a qualified ASL interpreter within 2 hours of arrival, not a tablet, a person, or a certified remote interpreter. Those are not the same thing. Fournier nodded slowly. No patient is documented as combative or non-cooperative until nursing staff have documented, in the chart, what communication methods were attempted and how long was given. Charlene looked at her hands. No student or non-essential staff enters a patient room for observation without explicit patient consent, in writing, in the patient's primary language. No staff member records a patient or a colleague without consent. She looked at Tyler without expression. That's already policy. Enforce it. Tyler did not look up. And ASL training, basic mandatory, every nurse on this unit within 6 months. Fournier wrote, approved. Captain Brandt's expression did not change, but something behind it did. Grant's voice came from the doorway, rough, underused, the voice of a man who rarely heard himself speak but had decided this moment required it. And taught by her. Cora turned. He was in a wheelchair, chest tube chamber balanced in his lap, looking considerably more stable and considerably more stubborn than someone with a recent pneumothorax had any right to look. Absolutely not, Cora said. I'll attend, Charlene said quietly. Tyler looked up for the first time. Me too. Cora looked at all of them. At the mission statement on the wall, respect, integrity, service framed in the kind of dark wood that suggested the words needed help staying put. She looked at Grant. He signed slowly enough that the whole room could see if they knew how to look. You didn't choose this ward. You didn't choose this unit. You chose to stay in the room anyway. She signed back, small and private. You were my patient. His hands moved again, before that. She didn't answer that one. 3 weeks later, Unit 7 looked the same from the hallway. Same squeaky supply cart near room 4. Same ceiling tile above the nursing station that maintenance had been promising to fix since October. Same burnt coffee smell in the break room. The ASL training sheet in the staff lounge had 14 names on it. Charlene had signed up first. Dr. Paxton's photograph was gone from the Physician Excellence display near the elevator. Tyler had requested a transfer to another unit. His paperwork included a letter, 1 paragraph, addressed to Cora. She read it once and put it in the recycling. The words were the right words. She hoped he meant them. That was all she could do with it. On the Thursday of Grant's discharge, he stopped his wheelchair at the nursing station on the way out, the same spot where Charlene had announced his name like a punishment 15 days earlier. And he signed for a long time. Cora translated, her voice even and carrying through the ward. You thought silence made him weak. You thought her quietness made her easy to use. You thought a patient's disability was something you could hand to someone as a joke. The hallway was still. You were wrong about all of it. His silence held more patience than you had the grace to deserve. Her quietness was what remained after the world had asked too much of her, and she had given it anyway. And his disability, she paused, signed back at him for 1 moment, and he nodded. His disability was the first honest language spoken on this ward in longer than you'd want to admit. Captain Brandt, standing near the elevator, raised his hand. Not a salute, an acknowledgement. One person to another, across whatever the distance was between what they'd been and what they were now. Cora returned it. Then she lowered her hand, straightened her badge, and walked back toward the nursing station. The badge read Cora Finley, RN. No rank, no call sign, no record of the things she'd done in rooms that never made it into any citation. It was enough. Months later, people still got the details wrong when they told the story. They said the new nurse turned out to be Special Forces. They said the deaf veteran exposed her. They said the whole thing began because of a dare. None of that was quite right. What it began with was smaller. A name on a patient board, handed over with a smile that meant something else entirely. A hallway full of people expecting to be entertained. What it ended with was a ward that listened differently. That's what stays with me every time I come back to a story like this one. Not the extraordinary part, the classified file, the Kandahar Road, the catheter placed in exactly the right space at exactly the right moment. Those things happened. But they happened because of something more ordinary underneath them. One person decided that a patient's dignity was worth protecting even when nobody else in the hall had thought to try. The prank didn't fail because Cora Finley was exceptional. It failed because they underestimated her, and she kept showing up anyway. That's it, that's the whole story. Thank you for being here for this one. If it meant something to you, leave it in the comments. Tell me where in Canada you were listening from, and tell me if you've ever been the person in the room that nobody took seriously. I'd like to know. Until next time.